Rabies is a serious public health problem in over 150 countries and territories, mainly in Asia and Africa. It is a viral zoonotic inhalated tropical disease that causes tens of thousands of deaths annually, with 40% being children under 15. Dog bites and scratches cause 99% of human rabies. It can be prevented through dog vaccination and bite prevention.
Rabies is a serious viral disease that caused by the Rabies virus. It can affect the central nervous system, which include the brain and the spinal cord, leading to severe illness and death once the symptoms appear. So the virus most commonly spread through the bite or scratch by infected animals, especially dogs, but it can also be transmitted through saliva entering the mucous membrane and broken skin.
Okay, so now I will explain the etiology of the rabies using 6 chains of infections. So first, infectious agents is the rabies virus from the Lissa virus genus. After that, the reservoir are infected animals such as dogs, bats, foxes, and raccoons, where the virus lives and multiplies. Third, quarter of NCd is through the saliva this infected animal, which come out during the bite or scratch. After that, for mode of transmission is mainly through animal bites, scratches, or saliva that come into contact with broken skin or mucous membrane. Then, portal of entry is through open wounds or mucous membrane such as the eyes, nose, and mouth. So lastly, for susceptible hosts include human and other mammals who have not been vaccinated or have weak immunity. So in conclusion, rabies follow a clear chain of infection from the virus to the animal, out through saliva, transmitted by bites and entering the body, and finally infecting a new host.
As for someone that have rabies, they will develop these signs and symptoms. I will explain stage by stage. First stage, prodromal stage or early symptoms. For this stage, usually happen around 2 to 10 days. Symptoms such as fever, headache, malaise, and sore throat. Plus, the classic early signs such as pain, tingling, burning, or numbness at the bite site. Second stage, acute neurologic stage. 2 main forms can occur for this stage. The first one is furious rabies, the most common. It will develop hyperactivity, confusion, hydrophobia, which is fear or spasms when trying to drink water due to throat muscle spasm. Aerophobia, fear or pain triggered by air currents, hallucinations, and aggression. The second one is paralytic dumb rabies, which is more gradual but less dramatic. They will feel flaccid muscle weakness starting at the bite site, which progressing to paralysis, loss of sensation, and reflexes, and usually may be misdiagnosed as Guillain-Barré syndrome. Lastly, coma and death stage. Without treatment, rabies almost always progresses to coma and death within 1 to 2 weeks after symptoms appear, usually due to respiratory or cardiac failure.
Now let's move on to how rabies is diagnosed. Because rabies is difficult to confirm clinically, we need laboratory tests. These tests are divided into 2 categories, which is antemortem and postmortem. Okay, in living patient, no single test is 100 accurate, so we use several tests together. First is saliva, tested by reverse transcriptase polymerase chain reaction to detect rabies RNA. Several samples are also collected at different times. Second is skin biopsy. From the nape of the neck, check with immunofluorescence to detect rabies antigen in nerve endings of hair follicle. Next is corneal smear or eye swab. So it's gently touch on the surface of the cornea. Then what it's gonna do is the smear will stain with fluorescence antibodies. Then the tender fluorescence microscope will see the rabies antigen corneal nerve will glow. Last is cerebrospinal fluid and serum. Tests for rabies-specific antibodies if the patient was never vaccinated with the presence of antibodies starting infection. For postmortem, after that, rabies is easier to confirm because the virus is abundant in the brain. First, the gold standard test is the direct fluorescence antibody test on brain tissue. Fluorescence level antibodies are applied under a microscope. Rabies infected neuron globin. Other methods include reverse transcriptase polymerase chain reaction on brain tissue to detect RNA. In summary, rabies is confirmed using a combination of tests before that, but after that, the direct fluorescence antibody test on brain tissue is the gold standard.
I like to talk about medical treatment. Imagine if you are exposed to potential rabies infection, the very first and the most critical step is immediate action. The wound, whether a bite, a scratch, or any mucous membrane contact, must be thoroughly washed with a soap and clean running water at least for 15 minutes. Next, it's essential to seek medical care as soon as possible. At the healthcare facility, a detailed risk assessment will be conducted to determine whether a post-exposure prophylaxis or PEP is necessary. If PEP is required, rabies immunoglobulin or RIG will be injected around the wound to neutralize the virus. Additionally, a series of rabies vaccine shot must be completed over a course of 2 weeks to build immunity. This treatment is very effective but must start before any symptom appear. When symptoms like confusion or paralysis develop, rabies is almost fatal and no cure exists. So remember, quick wound cleaning and prompt vaccination can save your life from this deadly virus.
Now, Haziq and I will be talking about 3 nursing care plans for a patient with rabies.
Okay, we will highlight 3 important nursing diagnosis, followed with 5 key intervention for each entity.
So for our first nursing diagnosis is ineffective breathing pattern related to respiratory muscle spasm. Since rabies can cause spasms in the throat and also breathing muscles, patients may struggle to breathe. So our nursing interventions include: first, monitor patient vital sign, especially oxygen saturation, respiratory rate, and also level of consciousness regularly. Second, position patient in semi-phallus position or upright position to expand the lungs. Third, provide oxygen therapy as prescribed by doctor. Fourth, prepare emergency equipment for advanced airway support just in case respiratory distress worsen. Fifth, reduce environmental triggers such as excessive light and also excessive noise that may provoke the spasm. All of these steps helps to ensure that oxygen supply is maintained and complications are minimized.
Okay, for the second CP is imbalanced nutrition less than body requirement related to decreased swallowing reflex. Okay, rabies often affect the swallowing, making oral intake to more difficult and unsafe. Okay, for the intervention, number 1, we have to assess patient nutrition status and daily intake carefully. Then collab with the dietitian to provide a high calorie and high protein diet. Number 3 is monitor patient weight, hydration status and lab value. Number 4 is providing a small and frequent feeding. And the last one is educate family member about safe feeding technique and the importance of proper nutrition. Okay, this intervention can ensure that the patient maintain proper nutrition and energy during the illness.
So for our third nursing diagnosis, which is a hypothermia related to viral infection. So for our nursing interventions include: first, monitor patient vital signs, especially temperature, regularly. Second, administer antipyretics medications as ordered by doctor. Third, provide tepid sponging bath if the fever is very high.
Okay, number 4 is encourage adequate fluid intake to prevent dehydration, and number 5 is adjust the patient environment to provide comfort. Okay, this intervention will help to bring the body temperature back to a safe level and relieve discomfort. Okay, so overall our nursing care plan is focusing on keeping the patient breathing stable, ensuring good nutrition and managing fever while also prepare for any complication. Okay, by doing this we support both the body needs and the patient comfort.
Rabies is dangerous disease that can be prevented with the right care. So now I will explain 4 important health education points for patients with rabies. The first one is Wound care. If a person is bitten by an animal, the wound must be washed immediately with running water and soap for at least 50 minutes. This step helps to reduce the virus at the wound site. The wound should not to be tightly covered and the patient must go to the hospital quickly. The second is vaccination. The rabies vaccine must be taken according to schedule on day 0, 3, 7, 40 and 28. It is very important not to miss or delay any dose because incomplete vaccination will make the treatment less effective. For severe bite, the patient may also receive rabies immunoglobulin. Third is recognizing yearly symptoms. Patient and their family need to watch for signs such as fever, tingling, or numbness at the bite site, difficulty swallowing, or even fear of water. If the symptoms appear, the patient must seek emergency treatment immediately. Okay, lastly is prevention and family education. Patient and family members should avoid contact with stray or wild animals and make sure all pets such as dog and cat are vaccinated regularly. Family members also to know basic first aid for bite, which is to wash the wound and seek medical care right away.
In conclusion, rabies is a fatal viral disease that affects the nervous system, causing progressive brain inflammation, and once symptoms appear, it is almost always deadly, but it can be prevented through prompt vaccination after exposure.